Hey everyone, I'm your host Adrian. We do content like this weekly, so hit the subscribe button and ring the bell to get notified. If you want more content like this, click the like button and please leave a comment. Thanks again for watching. Welcome everyone to today's Rupa University live class presented by Rupa Health, the simplest way to order specialty lab work. My name is Adrian Martinez and I will be your host for this afternoon. Today, we have a very, very special guest in Dr. Brandy Zachary here to discuss the Allergy 88 and AIBA for acne, eczema, and the allergenic patient, excuse me. Before jumping in, a couple of quick housekeeping items. Everyone joining will be muted by default, but don't fret. If you do have any questions, please use that Q&A button in the bottom of your menu, and we'll be sure to host a live Q&A session at the end of the presentation. Immediately following the presentation, yours truly will host that Q&A. And immediately following that Q&A, I'll hop right into Rupa to show you exactly how to order these tests that we chatted about on rupahealth.com. If you have to jump early, no worries at all. We will be sending out a recording of the session along with the slides within the next few days. And also, if you are a fan of this type of content, be sure to check out rupahealth.com to get access to all the previous sessions that we've done, including those with Dr. Z. So with that, let's go ahead and jump in. I'd like to introduce Dr. Brandy Zachary. Dr. Z is a clinical director at Body Love Clinic and lead instructor for the Functional Medicine Academy. Dr. Z has performed thousands of patient visits and trained other doctors worldwide regarding how to run a functional medicine clinic and analyze lab tests. She's a best-selling author, published with McGraw-Hill, New York, and developed software app to analyze patient lab reports. Thanks so much for joining us, Dr. Z. Super excited to have you with us again today, and I'll let you hop in from here and take over.
All right, thank you so much. All right, I'm excited to do this. Of course, instead of picking one lab, I picked two. And if you know me, you just know that's my style. But these two labs are actually from the same company. And I put the two of them together because I really like ordering them at the same time if possible. So I'll sort of make the case for why I think that's a good idea, but tell you how you can learn from each of them individually also. And then if you have questions at the end, for what other tests, lab tests do they connect to? I have plenty of things I'd love to share with you about that too. So please have some questions at the end. That's my favorite part. Okay, so Allergy 88 and AIBA, which I'm going to say AIBA all the time, but it stands for Advanced Intestinal Barrier Assessment. And I'm mentioning acne and eczema and sort of the allergenic patient as a whole. But as you see, as we weave through, there are so many other signs and symptoms that this test could be helpful for. Okay, standard disclaimer, I always make an effort that information is current and factual, and based on my clinical experience also, but as always, do your own research, due diligence, and always tie it into the clinical picture for the patient who's right in front of you. Okay, so here's what we're going to cover, just so you know, as I'm like weaving my way through. So we'll very briefly just talk about why I love labs, some key digestive questions that you can ask that might lead you to these questions, and a few exam intake examples. I didn't cover them all because it's something actually I do in like a much longer class, so we only have about an hour today, but I focused more like on the head and sort of giving you some signs and symptoms for that. How to assess which lab, if you're only going to use one, which one might you want to pick? Intestinal barrier testing, which is a lot of what AIBA is about, but there's other things you're going to see also, especially those of you that are working with histamine intolerant patients or mast cell activation syndrome or some of those disorders. This is a good test for you. So we'll talk about lipopolysaccharides. I'll showcase their support guide briefly, and Rupa is an amazing resource for all these tools. So if you, I don't work for Rupa, by the way, I just use Rupa and I love them. So they don't ask me to say this or anything, but if you're, needing help and trying to make sense of this whole lab landscape, they have amazing customer service. So it's not just about ordering. They're really like your spokesperson and assistant between you and the labs. All right, we'll talk about a few red flags, lymphatic drainage. I had to throw a little bit of that in there. It's just relevant. I'll give you a few supplements to consider, and then we're going to get into that Allergy 88 testing. Weave through elimination diets and food reintroduction. I'll even sort of tell you the steps I share with patients and even how I chart it I know everyone has different methods of charting, so you can apply it to your EMR, but I'll show you what I do. And then I'm going to give you a little example right at the end about how to use this information to attract new patients. Because I know as practitioners, all you care about is clinical. I get that. We all think that way. I think that way too. But the truth is, we run a business, we have a practice, we need to meet people, we need to keep the doors open. And labs are an excellent way to fill your practice. So they don't just give you clinical information, they bring your ideal patients right to you. So I'll just show you a little peek, and then we'll do our live Q&A. Okay, so before I dive into all that, this is my introduction. I don't like to talk about myself too much, so I just tried to shove it right on one slide. But I am an open book, so if you have questions, I have nothing to hide. I'm happy to answer them at the end. My super, super short version is I've been the patient. I have a primary immunodeficiency disorder. I found functional medicine through my own illness and injuries, which I know is how a lot of you all found it too. And when I started getting better, actually a few people started showing up at my house, and I thought maybe I'll get a little office, and then it exploded. It was all cash practice, even low cost to begin with. And I did about $250,000 that first year, never working more than 7 hours a week for patient-facing hours. And then I've just continued to grow. Now it's a 7-figure business, and I love helping people set up their practice, whether it's in person or telemedicine or a mix. And I love all the different licenses that work in functional medicine. There's room for everyone, and I think we're better when we work together. So there's a little snapshot of my stuff. Okay, let's get into it. So why use labs? First of all, it's the objective findings, right? It's the gold standard for what the patient considers accurate. Now, can you begin doing something with patients without labs and help them? Sure, but they are going to be only slightly wowed by your degree and your in-depth knowledge of like female hormone cascade or 1-carbon metabolism. Otherwise, all they really care about is, here's the problem I have. Can you help me get to the other side of that and feel better again? And what can you show me that my brain can wrap around to say like, oh, I have something going on and I need to deal with this. So that is a huge advantage for labs. And then clinically, you get so much more specific information. We don't want to use things, by itself. It's not like a clinical finding is the end all be all, or a lab marker is the end all be all. We have to put that all together, but it just makes for such a more robust assessment of the patient, more specific in the direction you're going to go. So I just think, I just love labs. And those of you who do telehealth or telemedicine, labs are essential because you're giving up one part of the patient interaction, which is hands-on care, right? Doing a hands-on examination. And it doesn't mean you can't do a great job. You can, but you have to, like if you're doing 100% telemedicine, you have to become an excellent interviewer. So your medical interview and your history taking has to be impeccable, and you need labs, and you need to understand labs. So if you're new to this, I don't want you to be scared with labs. They're great. They're fabulous. And you're in the right place because Rupa will hook you up. Okay, I taught a whole class on this, so I'm only going to show you little snapshots of it, but I call it Dr. Z's easy as 1, 2, 3 method. So I'm just going to give you the concepts so you can hang on to that and sort of maybe know the areas you need to work on. So the first step is the patient who's in front of you, either physically or on the phone or video, and you have their history and whatever you use for an intake form. You have to look at that, see them, ask questions, and very quickly translate that into, these are the labs I think I need, and what is a priority order? Because some of those people, they come in with a suitcase of symptoms, right? And you could just say, hey, Rupa, let's order the catalog, right? And they're spending a fortune on labs. So no, we don't want to do that. We want to really prioritize, even if someone, like it's clearly indicated these 5 labs would really benefit them. It helps the patient a lot if you put it in priority order 1, 2, 3, 4, 5, right? Because sometimes maybe they're going to get the first 2 or 3, and then a little bit later down the road, a few months, you're going to pick up the other ones. But That's what you have to do as a practitioner, translate it into which labs are needed. Step 2 is you need to get those lab reports and very quickly translate those into, this is what this means. Because you, as a practitioner, you cannot be efficient and have a successful practice if you spend 10 hours going over every lab and looking up every marker. It's fascinating. It's a great learning tool. I suggest everyone at least try it sometime, but you need to get efficient at pulling out those key markers, knowing what they mean, what's the significance, and then that leads you to step 3. How do you take that information and translate that into protocols, into supplements, into lifestyle recommendations? So that's the 1, 2, 3 method, and just think of breaking it down in that way. I hope that helps you. Okay, let's talk about a few key digestive questions that you might ask in the history, either with paperwork or as you're talking to the patient, that specifically clue you into these 2 tests, Allergy 88 and AIBA. They're both blood tests. I'll show you both of them. So obviously if they have an allergy or history of allergies, food sensitivities, sinus issues, postnasal drip, runny nose, they're taking allergy over-the-counter meds all the time. Mood issues, particularly anxiety, so don't forget about that. Could be any mood issues, but anxiety is very common. Any skin issues, breaking out, acne, eczema, if there's like a yeasty looking rash, babies with diaper rash, thrush, toe fungus, all of these things, think of these tests. Bloating, even bloating that gets worse as the day goes on, gas, indigestion, I think I already mentioned acne, eczema, so you get an idea. All right, so just a few examples of what you might see in the exam, or even if you're doing video, you can ask them, or sometimes you see part of them and say, hey, get up close to the camera, right? So dandruff. A lot of people think dandruff is just some mystery, but it's often, there's a fungal component. So gave you some information on that. Loss of taste, a lot of people are dealing with that right now. Tongue changes, particularly white, thrush pattern, but there's other changes you'll see, geographic tongue, central fissure, and acne, right? You can often see it right on the face, differentiate between like where it is on the face and if it's whiteheads or blackheads or cystic acne. So these are all important clues. Okay, how do you assess which lab? That's sort of step 1, right? So if you were thinking Allergy 8 and AIBA and you were only picking one, this might be how you separate and say, I'm going to prioritize this one first. So if the patient's main complaint was rashes and acne, and you really wanted both of these tests, maybe as a priority, you would say Allergy 88, and then AIBA was the second one. If the patient came in and they already had a diagnosed autoimmune condition, maybe Hashimoto's or something, there's clearly a lot of inflammation, they have some pretty well-established allergies, they're feeling, pain, it could be even diffuse achy pain in their body, then AIBA might be the test that you prioritize. And often, like I said, I like getting the 2 of them together. All right, here's a few lab clues. Obviously, Allergy 88 and AIBA, but I wanted to give you a few other clues that point to we might have some barrier integrity issues or leaky gut. So, and why I'm listing this also is if Allergy 88 and AIBA weren't on top of mind, but you saw some of these other markers, then you might say, oh, I need to bring those tests in. That's a good idea. So obviously some blood labs, high allergy testing, elevated histamine or high eosinophils. AIBA, we're going to go through that in detail. Some of the stool tests, you might see Candida or H. pylori, Pseudomonas. I don't know if you know, I've taught it before. If not, go back to RUPA. They have the recording there. I did sort of a short SIBO test, but we do see a connection between H. pylori, Pseudomonas, and Candida, high likelihood of it being a SIBO patient. Some specific autoimmune bacteria. So this is on GI map, it's on some of the other stool tests. Klebsiella, for example, is a gram-negative bacteria. That outer layer of the cell, that makes up the bacteria is rich in lipopolysaccharides. It's part of its like form and structure and protection method. And those lipopolysaccharides get too high, that's what makes us feel like crap. And then also if they're getting out of the gut and across the barrier into the bloodstream, now we've got a problem. And that's part of what AIBA, measures. But if you'd only done a stool test and you're seeing like high Klebsiella, low Sig-A, high calprotectin, some of these other things, you might think I want these tests also. I gave you a few urine metabolites, could be some urine metabolites on the end of a Dutch test or organic acids test, and then also a breath test for, like Genova, for example, does a breath test for SIBO. And the reason I mention that is SIBO is one of those things that can contribute to leaky gut. Okay, so here's a little bit into intestinal barrier testing, some of the markers, because there's other tests out there, right? When you go through that RUPA catalog, you could say leaky gut or intestinal barrier testing, and you'll see other types of tests, and they all have their pros and cons. This one is my favorite because of the markers they have. So this talks a little bit about histamine and diamine oxidase. This is a bit of the first page. I'm going to show it to you in a bit more detail in a second here, but you can see headache, fatigue, hives, allergy symptoms, estrogen dominance, inflammation. So some of the ideas for, that could be a good test. Okay, here's a little snapshot of the first page. This is a very simple blood test, really 6 markers. So zonulin is a protein that helps control the tight junctions in the gut lining. So when zonulin starts to get elevated, that can be a marker for leaky gut. Here it is in the blood. Sometimes you measure it in the stool. It's a helpful marker. I just don't like it by itself for leaky gut, which is part of why I like this test. We have additional markers, okay? So in this example, you can see zonulin's getting borderline high. Now, diamine oxidase, or DAO, that is one of the main enzymes that metabolizes or breaks down and consumes histamine. And if that's getting low, right, this patient is at a disadvantage to metabolize and clear the histamine that their body naturally produces, right? There's many times histamine should be produced, If diamine oxidase is low and a supplement is needed, by the way, there's only a few companies that make them and have them in good quality and really the therapeutic dose. So I don't supplement with it casually or all the time. It can be a little bit of a pricier supplement. But if I see an example like this where DAO is low, histamine is high, and the patient's symptomatic, that's likely a time when I say, okay, let's bring some DAO in. I see more than one indication for why this would be benefit, because you can see this is sort of a double jeopardy for this patient. Not only is their DAO low, but their histamine is high. And this got high enough that you don't even see the little marker on the chart, right? It's off the chart to the right. And I've seen it crazy high, 33 and higher. So you'll get a whole range. But when you get that DAO low and you're getting that histamine high, this is in the bloodstream, so this is systemic, you're looking at potentially histamine intolerance. All right, AIBA, this is the second page, and here's our lipopolysaccharide. So we talked very briefly about when you measure like a stool test and you see some gram-negative bacteria that's been overgrown. It could be opportunistic, it could be increased risks for autoimmune or things like that. But you might be wondering, well, is this isolated just to the gut or is it getting in the bloodstream? Now you get to see it. Now, we're always exposed to some bacteria, right? So our immune system has to be involved and handle that. And that's just like normal day-to-day function. So there is a significance if these are low also. If these are low, it can indicate either ongoing infection that the body hasn't been able to get a leg up on, or even there could be an immune disorder or an immunodeficiency. So that might clue you into a couple other tests. And when they're high, though, you're suspecting an overgrowth of bacteria. It's getting across the gut barrier into the bloodstream, or there could even be a blood infection, but usually that's a more acute situation and more obvious. But otherwise, a lot of people can have this happen where they have dysbiosis, they have overgrowth in their colon, and they have leaky gut, so it's getting across into their bloodstream. It's causing problems, and I don't know. They're just like, yeah, I'm getting old, right? That's what they hear. Ah, you're getting old. That's just part of getting old. Not quite. So it helps to know, is this high? I wanted to show you a little bit, lipopolysaccharides. That says LBS, that should be LPS, lipopolysaccharides. So you can see it right there. This shows you a little bit of the outer lining of the bacteria and where you can see the lipopolysaccharides. This is important. When it gets out of the intestinal cells, so what I was just talking about, it can cause neuroinflammation, brain injury, which can lead to depression. So I see this quite often, that people get diagnosed with depression or some other mental health condition, and I don't even like calling it mental health. It's really like a brain illness or even a full body disease. And obviously, if it's acute situation and we have suicidal ideation and those things, it's a life-threatening issue, right? They need immediate, acute, life-saving action. But when they're in a place to look at this and work on this as a whole, there's always a reason. It just takes us the time to figure it out. This is one of the reasons. And that neuroinflammation, by the way, that increase your risk for dementia and Alzheimer's. You start mixing, dysglycemia and blood sugar issues. We've got a problem there too. The other thing, you'll see it in the notes here, but it can actually penetrate the cells. So let's see, I think I have it for you here. It's coming up. So this is the Ava Support Guide. I'm showing you snapshots of it. This is from the lab, Precision Point Labs. But when you order it for a patient and you get the report, this is typically at the end of the report. If not, you can download it from the lab, and then you can have that information just for yourself as a practitioner, or what we do is we share it with patients. So it just becomes part of the conversation. So this talks a little bit about high zonulin and histamine intolerance. I already touched on both of those. But you can see some of the symptoms of histamine intolerance. Now we're bringing in headaches, diarrhea, migraines, circles under the eyes. So you start to see sort of the bigger sequelae of what's going on here. Some more information about diamine oxidase. This DAO to histamine ratio, that's just a calculated ratio. So, I mean, it can be helpful, but really you can just see it right with your eyes. But otherwise, that's just a calculation between the two numbers. This is part of that AIBA support guide. This tells you some of the conditions associated with elevated LPS, lipopolysaccharides. Some of these I mentioned, right? And let's see if they put in here. Yeah, here's where it is. When lipopolysaccharides are high in the blood, it means not only are they passing between intestinal cells, but also directly through the cells, potentially causing neuroinflammation and brain injury. It can elicit a strong immune response. This is one of the reasons I really love this test. And I don't think a lot of people are talking about it, but I think it's a great test. I love seeing all these markers together. And I really love, I'm talking about both blood markers here, so we're going to stay focused on that. But I really love it too if you order a stool test for a patient and you get an AIBA, seeing what's going on in the gut and then what's going on in the bloodstream. I love that connection. This is part of what I already told you, low lipopolysaccharides and the clinical significance associated with, inflammatory bowel disease, sure, but it doesn't always have to be IBD. There's other things that it can be associated with that you want to explore. All right, also part of the support guide, it just goes through each of the markers, tells you a little bit of what the low levels mean or what the high levels mean, makes some recommendations, really helpful. So you're not sitting there guessing. And if this is new for you, as you do it more in practice, you get to see it and live it. I can tell you sort of some like ninja tricks at the end. Ask me a bit about specific supplements and we'll get into it. All right, connecting the labs to protocols. So that's really step 3 of my 1, 2, 3 method, right? So you figured out what to order. AIBA was one of the things you ordered. And then what do you do with the patient? So really connect that to the clinical picture. And you have to keep in mind, you always want to give your patients your best recommendation, but then you have to meet them where they are and you have to work with them. So don't freak them out by giving them 25 supplements that they need and they're new to this and they were just trying to take in, wait, I thought an allergy was only you get stung by a bee and you run to emergency room, right? They didn't even know that there was different ways that an allergy could show up, and that sometimes it's working below the surface and causing them a lot of issues, but they're not tying it together because their tongue didn't swell up and their throat didn't close. So work at the pace with the patient. Don't leave them on protocols endlessly. That's part of the advantage of labs. So if you understand, it's always good, whatever industry you're in, to understand what's the negative thought out there. And don't like be defensive or take it personally. Every industry has a negative thought, right? We can mention attorneys or we can mention mechanics, you know? So one of the negative thoughts for functional medicine is, oh, you're going to be on supplements forever and they're going to make you take a million supplements. So when you know that's a negative thought out there, just address that in the beginning. What I tell patients, and this is how I practice, is when I recommend a supplement, I'm doing it for a reason based on what you bring to the table, what I see in labs, and I'm doing it for typically a short amount of time. I'm looking for a shift, I'm looking for a change, and then I'm looking to be done with that supplement, right? If we run into something, they have to stay on it, I'll tell you. You know, that's what I say, I'll tell you. But otherwise, typically, we're trying to initiate a change and then be done with it and move on. Okay, let's keep going here. Here was one example. I just wanted to give you, before I get a little bit more into some of these labs, I wanted to give you a 1, 2, 3 step example. So this patient came in, they had a history of infections, autoimmune disease, SIBO, anxiety, depression, chronic pain, fibromyalgia. This patient had a lot going on. They came in with a binder of previous lab visits and docs, and you can see insomnia, fatigue, food sensitivities, occasional flushing or rash. You know, ding, ding, ding. Think about that for these tests too. Irregular BMs, frequent UTIs. I reviewed everything, and you know, that's another advantage of bringing in those old tests is how is that helpful information? At a minimum, it sets a baseline, like where was the patient before, and we can bring them back. Or it's like, oh, this is great information. That's one lab we don't need to order. Now I can go order this one instead. So for this patient, I ordered a immunoglobulin panel, and we added Allergy 88 and AIBA. So that's why I brought this one out. So step 2, look through everything. It'll look at potential missed patient. That's an acronym for a metabolic condition, metabolic immune sensitized syndrome and energy dysregulation. So if you see me present about that, you know it. Otherwise, we could just call it hot mess, medical mystery, really sick, but told it's all in their head. That could sum them up too. So there's no primary immune disorder, multiple IgE allergies and IgG sensitivities, plus yeast and mold, all saw on the Allergy 88. So I think you're going to love it when I get into that test. And then they had high histamine and low DAO. So that was step 2. How did we translate that into care? So step 3 was we scheduled weekly health coaching visits for support because this patient needed high touch. They had really gone through a lot of other practices, was definitely overwhelmed, had a more complex case, was highly sensitive. When someone's that sensitive, you often need smaller protocols and you see them more often. So that's what we did. Practitioner visit 2 times a month, was prescribed LDN, referred to a psychiatrist for potential ketamine treatment. We don't do that in our clinic. This patient had depression, pain, and anxiety, which are 3 things that could potentially be helpful with ketamine IVs, and to break that sensitized syndrome and that pain cycle. It was just such a worn, deep groove, nothing would touch it. We did elimination diet with the allergy testing. I'll talk about that. We did a digestive aid with DAO, and as supplemental antihistamine before meals. We focused on some palliative and pain relief and digestion before doing root cause issues because this patient was so sensitive. We brought in some GABA, some SPMs, specialized resolving mediators, and some melatonin. Melatonin, hopefully you know, is more than just sleep, but it's also immune modulating. All right, so diving back into leaky gut a little bit more, intestinal hyperpermeability, barrier issues, barrier integrity issues, whatever you call it, leaky gut's here to stay. You actually see it showing up in research now, and patients like it. But essentially, bacteria, toxins, undigested proteins leak through the intestinal barrier. They either weren't supposed to get across, or they were not entirely digested or metabolized sufficiently before going across. Here's a list of some of the symptoms. And the thing I just wanted to touch on, that's not really the deep dive for today, but leaky gut, you could have leaky brain or leaky lung, right? So we want nice barriers throughout the body. If we're supposed to have a barrier, we want a nice strong barrier. Okay, so here's a little image. I gave you the resource so you can see it for yourself. So you can see like a normal tight junction, a leaky inflamed junction, and sort of the process, that entry of toxins, pathogens going into the bloodstream, how that contributes to autoimmune response. So just to put that together for you, super, super clear, you get a patient, they had some GI issues, so you're thinking I'll order GI map. Then you find out they're diagnosed with Hashimoto's, this autoimmune condition. They're wondering, how did I ever get that? You get your GI map back. You see Klebsiella is very high, which is an opportunistic bacteria that is known to initiate and sustain the autoimmune process. You order AIBA, and now you see lipopolysaccharides are high, histamine's high, zonulin's high. That can be very likely cause or contributing factor, right? So can we work our way backwards and see what kind of resolution or improvement we can have? This is that same article, so do look it up. I think it's a good one, and there's plenty out there now. There's a lot more research, but this shows you some of the triggers that can contribute to leaky gut that leads to that process. Here's some other causes, signs, and symptoms. So a disruption of gut lining, improper absorption, inflammation, leaky gut, really sort of describing itself, and multiple food intolerances. So far more common than you think. Here's a little snapshot, leaky gut, what's the protocol we want to do? First of all, stop the damage. If we just try to repair the gut lining or support the gut lining, but we don't stop what's punching holes in it, we're not going to get ahead. So you have to stop what's contributing to it. So if SIBO, for example, or gluten or something like that was contributing to leaky gut, it's not enough just, I have this amazing, GI supplement that's going to really soothe your gut lining. That's great, but we need to stop what's poking holes in it. So number one is stop the damage. 2 is repair the gut membrane. 3 is ongoing mucosal nutrient support, because you're coming from behind here. You have to give it some repair, and then support healthy bacteria in the colon. So address the dysbiosis. Here's some supportive nutrients. Very common. Sometimes you might have a supplement that has most of them in there. Some you might not have thought about were immunoglobulins. Another thing you might not have thought about is some people can't take glutamine. They either have a medication they're on, or they drive that GABA glutamate pathway. So they feel more anxious or get a headache or immediately irritable. It's like when someone has MSG, right? It's a similar response. So if that's your patient, then watch for leaky gut blends, because they almost all have glutamine, because it can be great when indicated, but those patients, you might have to avoid it. A few red flags and referrals with this kind of patient. If you're a physician and you're also acting as the primary, then you're keeping an eye on this anyway. Those of you that are not acting as a primary, which is most people in functional medicine, right? You have an agreement that says, here's what I do. You need to have a good relationship with your primary care physician, do your regular exams, I'm not on call, go to ER in a crisis, et cetera, et cetera. So then you need to know when to refer. So if you see wasting, excessive or unusual weight loss, they can't consume food at all, severe maldigestion, malnutrition. And if you do this long enough and you work with enough complex cases, you're going to see all this stuff. I've been on with like Kaiser battling for a patient that they were ignoring. This is an adult who was getting down to like 83 pounds. I mean, just crazy stuff happens. So you have to know when to refer to. And you can see some of the other signs here. Abdominal pain with fever, right? Okay. Signs of lymph issues. I just want to briefly toss that out there. I've taught a whole class on it before, but lymph is important. People used to think of it, oh, it's just our garbage can. No, it's really an immune organ. Very, very important for overall health. So some of the signs that you would have lymph, you can see swelling, edema, constipation, some of these rashes. These are some similar signs and symptoms. And the reason I mention it, it's just like how you don't do like a liver detox or any type of kill protocol before you make sure that exits are open, right? People need to be able to cry and have saliva and sweat and pee and poop, right? If something's not working right, we have to work on that first before we go after any of these other things, even root cause things. And I know we're the root cause practitioners, because otherwise you're going to really make someone feel miserable. Not good for them, really bad for business. So yeah, no one wants that. Okay, we'll keep going. I can answer more questions about that later. With lymph, think drainage. It doesn't have a central pump, so it's not like our blood vessels and stuff. We have to move. So children are like lymphatic machines. They do cartwheels and headstands and jump up and down and somersaults. And as an adult, I don't know about you, but I realized one time I was like, I don't think my feet have left the ground, and like I've caught air in 3 years. So, okay, I'm getting older, time to do something different. So we get out a rebounder or we do downward dog, we come up with ways that we can do it too. For the people who are like hugely obese, hugely sedentary, they need to get things moving. They're really stagnant, but downward dog would send them to the ER. They can't do that. Lying on their back on the bed and lifting their legs up or even putting them up against the wall, that is still a type of inversion and much safer for them to do. Okay, but you can see here, leaky gut, AIBA, one of my favorite tests. And I also mentioned inflammation panel. We order this through RUPA all the time. Myeloperoxidase, high sensitivity CRP. This is lipoprotein associated phospholipase A2. I call it LP play. It's just too long to say, but those are very helpful markers. All right, a few supplements and herbs to support lymph. So as you're putting this picture of the patient together, you start seeing multiple issues. You can say, oh, I don't want them to have a huge pill count. So I see something that's going to support gut lining, something that's going to support lymph. Great. 2 for the price of 1. So I put a few things in there. Some activities to support lymph. Most of these are probably very familiar with you. Roller ball therapy, you might not know about. A PT developed that. Love those little squishy balls. Usually I have them within reach. I don't, but you could buy them and sell them in your clinic, or you can get them right on Amazon. So I'll leave you to look it up, but very low cost, very effective. Okay, let's jump into allergy testing. When is it indicated? So some people like to just do IgG testing in the beginning. I don't like that. First of all, I think IgG by itself is not enough information, which is why I'm showing you this Allergy 88. I think it's a superior test. And a lot of people can have high IgG markers, and then you limit them and they're eating nothing. It's getting too restrictive. But what got missed was, they had something contributing to leaky gut. They had something else going on. So it's not like this is some long-lasting food sensitivity that's going to be there forever. We need to go backwards and work on the actual issue. So that's why I typically don't do that from the beginning. Or if I see I want to do something similar, I'm getting this Allergy 88, I want more markers. But anyway, here's some of the signs and symptoms. We've covered a lot of these already. Don't forget musculoskeletal joint pain and stiffness and swelling. So sometimes, like if we're a structural person, we think just structure and then we forget about the nutrition. Or if we're the nutrition person, we just think about inside out and we forget about the structure. So if you don't do both in your practice, this is a great opportunity to connect with other practitioners and people in your local community. And if nothing else, get together, talk shop, and have a fun lunch, but also have some cross referrals, right? I would always try people's services. So if I was giving a referral, I had a good idea of what was going on. Okay, allergy testing, putting it into clinical practice, typically avoid the foods that show up for a minimum of a month. The reason you do a minimum of a month is that the sort of downstream inflammation from IgE and IgG, if you get rid of those offending foods, the half-life, it clears in about 3 weeks. So that's why people say a month. Now you'll see when you look up the support guide for this test that they're like 2, 3 months, sometimes even 6 months. So I just have a real conversation with the patient. What are you willing to do or not? So I'll show you a little bit more about that. Gluten can take 6 months or more. And that is not dose dependent. So if they're having an antibody response, just a tiny little bit can cause that. And then the really important thing is it's not just cutting out food. That's why you get all these patients who like go to Dr. Google and they look stuff up and they're like, I'm on it. I'm going to do elimination diet and just cut out these top 7 foods. And they might get some good results, but they're guessing. This test gives you specifics. But the other reason they have a problem is they're just cutting out the foods and they're not doing anything to work on the underlying issues. So that's really where they need to talk to us. Understanding trigger foods. I just put in a little bit of notes about brain and head and mood disorders and behavioral issues. If you work with children, if they get diagnosed with, oppositional defiant disorder, or they're labeled as the disruptive ADHD kid, it can be so traumatic and really damaging as a child. But this isn't like, oh, you experienced a little trauma or something. This can actually change the whole trajectory of their life. How or even whether they go through school, the job they get, the relationship. So those of you who work with children, I think that's very noble, and keep these tests in mind. Yes, I have done them with children. Okay, mouth, nose, throat, chest, gave some obvious ones there. Did a little abdominal region, limb, hands, feet, skin. So these are some of the things you watch for. And then there are the 7 most common trigger foods. So that's what like a generic elimination diet would cut out. With this test, we can get more specific. With elimination diet, they do need a lot of coaching. So keep that in mind. Either maybe have some group options for them, or if you have a health coach in your office or more frequent visits with you, they're going to want to do food reintroduction and journal it. So I'll talk a little bit more on that. Here's some snapshots from the Allergy 88 support guide. So this is the same lab, Precision Point Labs. Rupa can hook you up, and they really do have wonderful support materials. Not every lab does, but this company does. So here's a snapshot of the lab report, and this is what the cover looks like for their Precision Allergy 88 test results. It's like a 24, 25 page guide. I love it. I share this info with patients all the time. All right, here's a little snapshot of part of that test just so you can see it better up close. And what I wanted to show you is you can see sort of the first 2 columns talk about an allergy, and then these last 3 columns talk about a sensitivity. So IgE, that is a true allergy response, right? And it's not always anaphylactic, but that's an immediate allergy response. So it happens right away or up to 1 to 2 days later. These Ig responses, they can start 30 minutes after a meal up to 4 days later. And that's why journaling becomes important, because you might have a patient who says on Thursday, like, hey doc, I feel so crummy. I don't know why. I ate perfectly today. I ate perfectly on Wednesday, but they don't realize they're having a reaction to breakfast on Monday. And they didn't tell you that that was like the buffet at Vegas and they ate everything. And washed it down with vodka, right? But they're wondering why they feel bad because Wednesday and Thursday they did everything perfectly. So that gives you a bit of a clue here. So IgE, you'll see this. I could tell you a lot more detail about it, but I want to make sure I leave time for Q&A. So if you have questions, I'll tell you more about it. This immune tolerance. So IgG4, this is part of the desensitization response. Like when someone goes to an allergist and they're getting allergy shots, they're trying to increase this IgG4, not too high, because if it gets too high, it is a problem on its own, but high enough that you get this immune blocking. So the body basically has a receptor and doesn't have that antigen antibody binding. It protects from the more significant IgE response. So that's part of what you're seeing here. And then you have your IgG, and then this is complement. This specific part of the immune, the complement cascade, is has its own significance, but also when you see it, like here it is high for almonds, it can make this IgG marker 1,000 to 10,000 times higher, magnified, right? So this is part of how you want to start keeping it in mind. See how there's a candida marker here, so you can actually see an active candida infection. Sometimes you want a more detailed test, but this is a great thing to know when patients on a budget, you can only order so much. You're thinking, I really want an allergy test, but I think they might also have yeast. You have a yeast marker on here. And to see aspergillus, there's a mold marker too. So I love this test. Here I want to show you gluten. In this example, the patient had a true allergy to gluten. They were not celiac, right? That's a different level. You can have from celiac, true IgE, allergy, an IgG response, a non-celiac, gliadin antibodies in the stool. There's a whole range of how it can impact people. Okay, so it's called 88 because 88 foods, but you get all of these markers. Some other labs have this, but sometimes they'll charge extra for the markers, so I just like they have it all in one. This I already told you, but talking a bit about zonulin, I did want to show specifically that gluten can make that gut leaky temporarily, even in an otherwise healthy patient. So keep that in mind. And here's a bit of the mechanism. So I just wanted you to have that in the notes. Some of the next pages so I'll just tell you, I use this all the time. So page 1 and 2 for the Allergy 88 has those markers. The columns I showed you, the colors, lists all the food. Page 3 shows you the less restrictive diet. Now, unfortunately, their sample test is really a bad example because on their sample test, the less restrictive diet, it has such a long list. That's not typically what shows up for patients. It could happen, but most patients, the less restrictive diet, maybe you're getting rid of 3 to 5 foods, right? So it's less restrictive. They organize it for you. They could not have made your job easier, right? Now the next page, page 4. Oh, I didn't show it. Well, page 4 is the high restrictive diet. So page 4 typically has more. You're cutting out more foods, right? And then page 5 is this immune index. So they take all of the foods, all 88, and they list it based on all the markers that came back for immune reactivity. Now, part of how I use this is, I've got a patient in front of me, they're highly symptomatic. The less restrictive diet, they're like, I can do better than that, doc. But the most restrictive diet, they're like, I have to go into hiding. I have no idea what to eat. So that's where this page comes in handy because you can customize it. You can say, okay, we're going to just cut out the top 10 foods or something like that. So you can really customize it for the patient. All right, this is a handout you can use for yourself, get it from the lab, but it has information. You can see it talks about the 4 types of allergic reaction and they're testing for all of them. So everything I'm telling you, you don't have to remember, it's all in there. This talks a bit about IgG and complement, which I already told you. This is some of the pages inside that clinical reference guide. What do I do if yeast comes back positive? So some excellent information and notes on that, and great to be able to have a conversation with the patient. What should I do if mold comes back positive? And this tells you the specific 4 strains that they test. They'll tell you we don't know when we pick up these mold markers, so Candida, yes, there's a current or recent infection going on, intestinal overgrowth. If mold comes back, we don't know for sure if it's food or it's environment, but here's some valuable information to look at, and you can tie that into the food markers that came up. Here I gave a snapshot. This is a page from GI Map. Those of you who have done IFM, you're familiar with this. If you're not connected to either of those, just make your own. But you need a food reintroduction tracker, something where they've cut out the foods, they're going to bring them back in, and we want to do one food at a time and really watch them over 4 days, because some of those sensitivities could take 4 days to show. So we don't want to put everything back in all at one time, and we don't want to add a new thing every day. We won't be able to discern what's going on. These are just like some notes. I was just giving little examples of how to maybe grab phrases or tie it into your charting. Here's one I do, Allergy 88 Next Steps with the patient. Number 1, decide if you're going to go for the least restrictive diet on page 3, most restrictive on page 4, or we're going to customize it on page 5. That's step 1. Step 2, how long are you going to do it? Are you going to do it for 4 weeks, 6 weeks, or a few months? So this is a conversation with the patient, but we make a decision to move forward. I want them to have a good digestive aid. If histamine's high, I want them to drive it down, and we're going to do gut lining supports. We're going to work on issues while this is happening. And then we're going to use the food reintroduction tracking journal to reintroduce food. So that's sort of the 4 steps. And most of you who use EMRs, most likely that company has something where you can create phrases and they can automatically become chart notes or templates or something, so you can insert it in and not have to type it over and over again. I gave a few supplements to consider. Some of these could be happening with allergies that came up. Otherwise, a lot of these are very specific to gut lining as a whole. If Candida came up, I think I've taught it in another class. If not, Rupa probably has someone who has taught it. And I just talked a little bit about what to focus on, some key supplementation. Maybe in the question, we'll talk about biofilm busters or binders, some of the lifestyle changes and dietary changes. So you'll have that in the note. I did give you a few of my favorite supplements and topicals to consider. So if you use any of these product lines, you can look those up. If you don't, you can always look at the ingredient and see if your favorite product line carries it. And I just want to give another example. So this was a patient that came in. This is the 1, 2, 3 with labs, right? Patient came in, history of multiple antibiotic use, thrush following. Signs and symptoms were acne, rash, anxiety, sugar cravings worse at night, toe fungus lasting longer than 3 months, several UTIs, recent BV, diet high in simple sugars, recent dandruff. So I was thinking of testing for yeast via like oats, GI Map, or Allergy 88. I chose step 2, I chose Allergy 88 because I was getting the food allergy, the food sensitivity, and there was a marker for Candida and mold. So I thought this is a good test to start with. Based on the markers that came back, step 3, we recommend an anti-Candida diet. We used oil of oregano. We added a probiotic. We did the Colorex wash, some tongue scraping, and some rest. Okay, last couple things and we're into Q&A. This was just using labs and information to attract new patients. So this was something I did, Detox Disasters No More, 50 Ways to Love Your Liver. And it was usually a paid course, but through someone else, it was like an affiliate thing. We offered it for free for a short time and patients were able to get in and see it. So you can use it as a marketing tool. This was a detox we did and health coaching app. Those of you who use Designs for Health, you know about it. This was an example of a 5-class course series we taught for our patients and for the public. So part of that, give up front, don't just give back, but give up front. Classes had great content in it. And part of what really brings it home for labs is as we were talking about things, we would talk about the lab that you would order and what would make sense. Right? That's something tangible patients can hang on to, right? And then if they're interested, they're going to order that lab and you have to go over it with them, right? This was an example of a fasting with food, a 5-day fast that we did. And then we talked about some labs there. So I just want to give you a few examples. anyone who's curious about support, clinical consults, lab analysis, practice answers, you're welcome to schedule a no-charge consult with me, and I can talk to you about how we do it. We do academy and we do mentorship. So those are the only two things we do, but we cover a lot of content in it. All right, if you want to schedule a no-charge consult, that's the link. That's our email if you need to reach us, and our phone number. Otherwise, I would like to take some questions. I think I saw a few pop by, but Adrian, I don't know if you have more, or I can just.
I do. I've been aggregating these questions throughout the presentation, and we definitely have some really good ones that came in. So first and foremost, thank you so much for that presentation, Dr. Z. Always super interesting, and I love learning about these topics that I honestly have no clue about, as I'm not. So these are always really great learning sessions and opportunities for myself as well. But with that, like I mentioned, we got some great questions that came in. So let's just jump right into it. So the first question is, what is the optimal timing of DOA? Before each meal or just before meals with high histamine? How long before or after eating is optimal?
People do it differently, but the way I do it is about 15 minutes before the meal. That's just what I've found to be best.
Great. And I know you may have just covered this a moment ago, but what DAO supplements are good quality and could be recommended? I believe that might have been on those previous slides. Is that correct?
I can't remember if I listed the actual name or not, but I can tell you the two I use most often. Like ordering through Emerson, there's one called Pure Max DAO. Can't remember that company, but if you look it up, you'll see it, and it's on Emerson. There's two of them. I'm just mentioning the max part because that's the one that actually has the therapeutic dose. So there's a certain amount you need. And then the other one I use is a DAO supplement from Zymogen.
Perfect. How often should you be retesting patients?
Oh, that's a really good question. It really depends on who's in front of you, because sometimes these complex cases, before you even think about retesting, you have to think about bringing in a new test. So if your initial round of testing, you've made enough progress, but something else has been opened up, patients are typically paying cash for this. So I'm thinking, do I need to retest to see what I already sort of suspect we're getting better, or now because of what's going on, I really want to bring in this genetic testing or this, mitochondrial testing or, something like that. So honestly, I don't have a template. I customize it for every patient. Let's say that was not the case and you were just retesting. If it's allergy 88, 3 to 6 months would be about a retest. And if it was AIBA, if it's, significant enough that you're like, oh, I need to retest it, it could be as early as 2 months. And if the markers are really rough enough, you might retest that multiple times.
Yeah, that makes sense. So the next question is more of a scenario. So just because I do an IgG food sensitivity test and see crazy highs on many triggers, that doesn't necessarily justify a diagnosis of leaky gut. Do you want to see increased zonulin and LPS?
Yeah, I like to see more than one marker for leaky gut. And I always want to find out why. Why did they have leaky gut? So zonulin by itself, it's helpful, but I don't think it is a significant enough marker just on its own. It doesn't tell me enough. When you start seeing lipopolysaccharides and histamine elevated in the blood, it's more significant, right? I'm paying more attention.
Yeah, that makes a ton of sense. The next question that came in is, I heard Chris Kresser said that one provider sent his blood sample twice and got absolutely different results as far as food allergy. How reliable are these tests?
I think that depends on the lab. So I would call them. I don't know which company it was, but I've done that before. I mean, we're geeky enough. We've sent the same stool sample to 3 different labs at the same time just to check them out. So if you're like that, great, go for it. But yeah, check and see what methods the lab uses. And then also remember, especially when you're dealing with blood, it is a moment in time. So people can absolutely change, right? So what was the change between test 1 and test 2? If it's not a lab issue, what was changing in the patient's environment or what they were eating or with their health?
Yeah, absolutely. So the next question is, if a patient has a lot of IgE, how long is an elimination diet necessary?
Okay, so IgE is, a true allergy. And if they're coming up as high, that means that they're in the top 5% of reactivity. They may never resolve that. If it comes up as moderate, the orange, they're in the top 20% of reactivity, you might be able to reintroduce that. But that's an excellent case for retesting, like specifically IgE markers. But yeah, if you have a patient who has a true high IgE allergy, and then you see like all these other markers like, IgG4, IgG complements all high, that food might just be off the table. And that's fine. You might have to deal psychologically with a patient who's mourning the loss of gluten or almonds or whatever it is. But when they feel so much dramatically better, this is what I usually say, like, I'm talking to the patient and I'm commiserating with them. I was thinking of this one patient where it was like cashews or something, but it's like, yeah, that really sucks. Let's just cut it out for a little bit and then we'll put it back in, right?
Right.
And she came back later and she's like, yeah, I had this big response to putting it back in. So you know what? I'm just going to leave it out. And I'm like, that's a great idea.
Yeah, probably.
Let it be them, right? Let them figure it out. It has really big impact that way.
Sure, 100%. So the next question we have is, do you use any supplements for patients you suspect have fructose malabsorption?
Yes, but with fructose malabsorption, there's like something else going on. Do they have SIBO also? I typically have that test going on. I mean, they're more involved. I tend to see sort of two categories with that people are using that and getting positive markers, and really it's SIBO, and they're not seeing the rest of it, or they have that test and they have a lot of other positive tests, and this is really a more complex damaged GI digestive issue patient. So I have to figure out which one it is, but I don't have like one supplement that I say, oh, use that for that fructose patient. It's really just a clue. I have to look deeper.
Yeah, and that actually leads to our next question pretty well. So if a patient's P88 results have a very large number of reactions that are strong, even less restrictive, and it is a long list. So an overreaction, so to speak, as they're so triggered, where would you start?
I love those patients. I wrote my big medical case review on that patient who was a medical practitioner. So some of these patients, they might be histamine intolerant, they might have mast cell activation syndrome. So you have to look into that further. There's just so much to it. So where would I start? I mean, if it's just a question of what foods do I cut out and the list is too long, then go to page 5, that immune ranking, and maybe start with just the top 10 foods. While you're doing that, help to support the gut, work on drainage, work on inflammation, and then start digging. Why is this patient so reactive? Is there a hidden virus? Is there some genetic issue? Get into the under, right?
Yeah, absolutely. So the next question would be, is DAO supplemented just before high histamine foods or any meal if very low DAO?
If it's very low, I would do it before every meal, because histamine is produced, right? It's part of
Yep.
digestion and stomach acid formation and all of that. If you work on, if you get into mast cell activation syndrome and things like that, H1, H2, having to knock it down, you're going to be going down that path anyway. So it's not just high histamine foods. If that patient has high histamine and low DAO and you're having to give them DAO, you're probably advising them to avoid high histamine foods anyway. But that doesn't mean, oh, I don't need my DAO, right? They just need to take it before each meal.
Yeah, absolutely. And just a quick side note here, Dr. Z, how much time do you have? We do have a number of questions still left, and I want to be aware of how much time you have.
Well, let me see, and I will tell you.
Yeah, absolutely. Yeah, the questions are
Um,
flowing in.
I'm good. I'm
Okay,
yours.
perfect.
Go for it.
Yeah, absolutely. We want to be respectful. And just as well as an additional note to the audience who are still so gracious enough to stay a few minutes after, we're going to go through the Q&A, and immediately following this Q&A, I'm going to hop right onto Rupa and show you exactly how you can order these tests, as well as over 3,000 others all in one place through rupahealth.com. So jumping right back into it. If you see normal histamine but low DAO, what does that indicate?
Well, you can have a relative histamine intolerance. It's not actually histamine intolerance, but it's like when you are doing hormone testing, right? And I'm thinking of like the Dutch, which is a test I've taught on, and I know Rupa has covered it. I love that test.
Yeah.
You could have someone who, like, their estrogen's not high, but the other hormones are lower relative to that estrogen, or they don't metabolize that estrogen and clear it. So they end up in an estrogen dominant pattern, right? So you have to look at things in relationship to one another. So for someone who doesn't have high histamine, but they have low DAO, they're still going to have a problem breaking it down. And now you might want to also look at, do they have a hard time even making histamine? That can be one of the questions. So if they had enough symptoms, this is where I would tie it in. If they had enough symptoms, I would still supplement with DAO. If they didn't, if the clinical picture didn't fit, I wouldn't just automatically give it to them.
Yeah. Quick question here. What EMR do you use?
I use Jane, and I really like them, Jane software apps. So I used to have a, brick and mortar, like old school paper office, and it was great. And then I sort of saw the writing on the wall a couple years ago, and even before California shut down, I went virtual. People thought I was crazy, but like even before California shut down, there was like a video backdrop arriving, and my husband's like, "What's going on?" I'm like, "Just wait." So we entered the land of digital. So I did a lot of research, not to saying your answer will be the same, but when I went through all the companies, I just felt that they had the most to offer. It was the simplest, really good price, good customer service, and they keep fixing things. They're like Rupa in that way. You like companies that, they're always up leveling. They're working on their stuff, and they just make it better. They're relevant, right? They say relevant to what we need as practitioners. So I highly recommend them. And whatever EMR you use, one of my favorite things is that you set up a system where you can chart, like you build your template ahead of time. You can chart in the moment with a patient. You can attach that lab report. You can attach that, answer guide. Here's what it means. Here's what to do. And then right afterwards, you press a button. It goes to the patient. That's their after visit summary. You as the practitioner, you're done. You get to get up out of your seat and like walk outside, right? So some of the practitioners I train that are coming from like, nurses doing doubles and or being a pediatrician, they're not used to what functional medicine can be. They think really high patient count. They think hours of charting. It doesn't have to be that way. So, and
100%.
I'll tell you again, Rupa didn't ask me to say this, but when I went virtual, that's when we started using Rupa. So they were one of our first digital tools. Loved them. Before them, I had a full-time staff member who was dedicated to labs. So her job every day was to go in like 10 different lab portals, look for new reports, to order kits, to package them. We were like a UPS center to, send them to patients. And when she was doing it, I didn't care so much. I mean, it cost me money, right? But I didn't care so much. But when we went virtual and then I became the UPS center, I was like, this has to stop. And so I signed up with Rupa. I felt like I got a free staff member. And I always say, it's good when the rest of your staff says, if you stop using Rupa, I will quit. And that happened. That's a true story.
Words of wisdom from Dr. Z. You heard it here first.
We've been using them for years. They're awesome.
Absolutely. I think it's really important to just kind of understand what tools are available to you to, as a business owner, to be able to just make life easier, right?
Yeah, you have to be efficient. You have to be efficient. That will make or break you, right? It's not just for finances, but it's also for your sanity. In the beginning, you're so excited. I'm going to learn this 24/7, but you can't sustain that, right? You have kids, you have a house, you need to go on a bike ride, so you have to be efficient.
Yeah, absolutely. Awesome. So the next question we have here is, what do you think about an essentially negative AIBA, but a lot of food allergies and sensitivities?
So then there's other reasons for it. It's not necessarily from leaky gut, right? And there's many other things that can go on with blood. There's other ways you could have inflammation, right? Someone could not have leaky gut, but just the normal assimilation that happens in the small intestines, and they have a true allergy or a food sensitivity. That can absolutely happen. So you do see leaky gut a lot when there's, I get complicated patients, right? So they've got a lot of other things going on, but absolutely you could have allergies or food sensitivities and not have leaky gut.
I love it. So the final question here is, do you run these tests, both these tests, for pediatric patients? And is there anything specific to know when ordering these tests for pediatric patients?
Always talk to the lab. Rupa will tell you to. That's another thing. I sound like a commercial for Rupa. That's not my intention, but I really do like them. They have great like testing guides. Like, here's what you need to know. When you're the nervous practitioner and you're just starting, you're like, is this even a blood test or is this saliva? Like, Rupa has all that, and the instructions they send to patients, you can see that. So that's quite lovely. But sorry, what was the question? I totally forgot.
Can you use this on pediatric patients?
Oh yeah, peds. Okay. So anyway, ask Rupa or ask the lab, do you have different ranges for children? So sometimes they'll say, this is validated for, the population age 12 and up. Or we do have tests for age 12 and under, but it's a different scale. So you're going to get a different report. And if it's not validated for the pediatric population, honestly, sometimes I still order it, but I would see enough kids that I would understand the relevancy. One example I would say is like calprotectin. That's on most of the stool tests, most studied, marker for inflammation in the stool worldwide. If that gets elevated with adults, we're concerned, we're doing something about it. If you don't know that it takes about 48 months, 4 years before a child hits that adult range, you're going to see a child who has high calprotectin and freak out when you don't need to. But you can still see a child who has that high range and it's above what they should. So these are the things that you need to know. But I have absolutely done Allergy 88 and AIBA on children. It is a blood test. So with kids, if I can use something non-invasive like a stool test or a urine test, I'm always going for that first. But when I felt it was really beneficial, I just told the mama, all right, here's what I recommend, and we did it.
I love that. Awesome. Well, Dr. Z, that is it on our end for the questions. Do you have any final thoughts?
I would just say, start using labs if you haven't done it. And it's really, really helpful to make you a better practitioner. It's a great tool to serve the patient and bring them in. And the other thing I would say is you don't have to get sidelined by all the labs that are there. You can just sort of pick some good ones to start with per category and master those. Like one stool test you really like, one allergy test you really like, one hormone test you really like. Maybe, you can order Boston Heart from Rupa and you like them for their cardiometabolic test. So just sort of have one category, really learn those, and then that will help you for all the other labs that come your way. So don't avoid starting because you're thinking, I have to know 3,000 labs all at one time. No, you can start with 3 or 4, right?
Yeah, absolutely. And I think those are definite great words of wisdom. We appreciate you as always, Dr. Z. Thank you so much for joining us today.
Thank you, guys. I'm going to take off, but good luck for the rest of it.
Thanks so much. All right. So thank you so much for those y'all that are still sticking around with us here. I know we went a few minutes over, but what I'd love to do is just jump right in and show you exactly how to order these tests today through Rupa Health. I know Dr. Z did a great job of giving us plugs and chatting about kind of what Rupa is, but I'd love to show you. I think it's really powerful to actually kind of see what Rupa does and how efficient and effectively we can work in this lab test and ordering process. So I'd love to start from the top, right? Who is Rupa Health? What do we do? So Rupa Health is a platform that is designed to make life easier when it comes to ordering tests and managing the process of testing. Our end goal is to bring functional medicine around the world, make it more accessible, make it easier. So in order to do that, what we've done is we've made life easier for the practitioners and the patients. So how we've done that is we've brought on over 25 different labs, over 3,000 different tests in one place. So now, as opposed to you as a practitioner having to have 6, 7, 8, 10 different accounts with different labs and having to go to each individual portal to place your orders, track your results, so on and so forth, you have one account with Rupa Health and you have access to all these different labs in one place. What I want to show you next is just really how easy it is to place an order on Rupa, right? So to start an order, you just go up here to the top. We just need the patient's first name, last name, and email address to start an order here on Rupa. And then from there, I'll show you what the order screen looks like. This is your order screen. You can create custom bundles up here at the top, a bundle being a set of tests, a set of blood panels, really a combination of blood panels or tests from any one of our partner labs that you want to work with. One click, all those kits added into your cart straight away. Below that, you can create a favorites list. So a favorites list being an individual test that you're commonly ordering. So that way it's up here at the top. The idea here is so I don't have to search through an entire catalog, again, of 3,000 different tests to find exactly what I'm looking for. So if I'm looking to order the AIBA and I'm looking to order the Precision 88, those are right here at my fingertips. And from there, honestly, it's as simple as clicking send a patient. So that's how you place an order on Rupa Health from over 3,000 different tests within a matter of seconds without having to go to 10 different portals to do so. One portal, everything all at your fingertips. But of course, we have a couple of different ways that we can customize this test. So you can see things such as scheduling a test out in advance. I know that we chatted earlier with Dr. Z about how we schedule tests out or when to retest. Through Rupa Health, you can actually reschedule tests and retest a patient automatically. We offer wholesale practitioner prices. So I know there was a question in the chat earlier as how much these tests cost. The prices offered at Rupa are the same exact prices that you would get going directly to the labs themselves. We offer that wholesale practitioner price. The way that we generate our revenue is simple. There's a flat 7% processing and ordering fee on each order, and that's paid for by whoever's paying for the tests. What that means is if you as a practitioner are having Rupa bill the patient directly for the cost of these tests and the patient is paying for the tests, they will be the one absorbing this cost. What it means for you as a practitioner is that Rupa is free. This 7% is the only way that we generate our revenue here at Rupa. So if you are having Rupa bill the patient directly every single time, you will never see a bill from Rupa. So pretty cool, right? Of course, we do offer the option of having you pay for the tests. So if you are in a clinic where you want to pay for the cost of the test and bill the patient separately, maybe you want to bake in things such as an interpretation fee or upcharges, this is your option here. You'd be able to pay for the tests and bill the patients outside of our platform. From there, you can add notes for the patient, you can add notes for Rupa, you can add ICD-10 codes, and if nothing else, it's as simple as I mentioned before, clicking send a patient. So with that, y'all, that's how easy it is to place an order on Rupa Health. The next thing I want to show you is how you're tracking all your orders. So again, if you take it back a couple minutes ago, I mentioned that traditionally you'd have to go to each individual portal to place your orders, right? And not only that, to track all of your results as they come in, a number of different forms of communication that you have to go and check in on. Through Rupa Health, once you place that order, you can track everything through here. So I can click into an in-progress order, for example, and I can get an idea as to when the results, or rather when the samples arrived at the labs, when I can expect the results to come in if the lab is providing us with that. And from there, you can actually have one single line of communication, right? One single source of truth. I don't have to go to each individual portal to check this information. And it allows me, as we mentioned previously, to work more efficiently. Efficiency is key here, especially in today's day and age. As a practitioner, you don't want to spend hours of your week focused on the support or the admin work having to do with these tests. Unfortunately, it is a component to it and an important component to it, but Rupa will manage all that for you and allow you to work more efficiently. As the results come in, you're able to hop right into your Rupa Health portal and view all your results straight away. You can download the results, the same results you would be getting directly from the labs themselves. Rupa is not making any interpretations or any variations to these results. Same results you'd be getting directly working with the labs. You can send the results to the patient as well. This is a HIPAA compliant link that we would send directly to the patient. You can also schedule a clinical consultation. So should you need some assistance interpreting the results directly from the labs, you can actually schedule times with them. So we interface directly with the labs. We partner with the labs in order to do this. So you can schedule some time with one of their clinicians to help interpret those results once they come in. And then from there, you'll have access to a requisition should it be available. All this again to say that everything is all in one place for you. One place to order all your labs, one place to get all your results, one place and single source for information. Now, the next component to Rupa Health, which I really want to highlight here, is the patient experience. So a lot of the pain points that are associated with these lab tests and the process surrounding them have to do with the patient experience. It can take a lot of time. When you think about the questions that can be involved with them, when you think about the pricing transparency, how do we actually get the patients to complete these tests and comply with the instructions and complete them? So we'll help with that. So as soon as you place an order on Rupa Health, we can effectively take it from there. We'll reach out to the patient, let them know that the tests have been ordered for them. We'll collect payment. We'll also accept multiple different payment types of payment. So we can do not only HSR, cash or credit, but we can do HSA, we can do FSA, as well as we can even set up a 3-month interest-free payment plan. Beyond that, we'll send over FAQs, instructions, and oftentimes videos walking your patient through how to take the test. If they have any questions, they can reach out to us and our team, and we'll facilitate answering those questions on your behalf. So we'll manage the whole patient support side of things, right? So saving you and your clinic a lot of time. We'll walk them through how to fill out the requisition forms. And then additionally, if there is a blood draw required, like there would be with this P88 as well as the AIBA test, we will help coordinate that directly with the patient. So we'll send over options based on the lab that they're working with, each lab having their own network of blood draw locations that they have. So we'll send that to the patient. Beyond that, if you're lucky enough to have a phlebotomist in-house or a preferred location that you want the patient to go to, we can always customize that information as well. But if the patient wants additional help, or maybe they want some additional options, maybe they want a mobile phlebotomist to come and see them, they can reach out to us and our team, and we'll actually do those searches on your behalf to send over the best possible options for them. From there, we'll follow up with the patient, see if they do have any questions. We'll manage any specimen issues, which is another really important thing to call out. So if there is a specimen issue, we'll manage that directly with the patient and the lab to process that recollection. So you don't have to be involved. Of course, you will be alerted. So, you'll be in the know at all times. But ultimately, what we've designed here is a patient experience that is come to be expected with patients in 2022, right? The ability for them to reach out and contact a human via email, via text if necessary, to get that white glove service. All this has led to a compliance rate up above 85% for our patient community. So really important call out. So what I've shown you thus far is, how to place your order from 25 different labs, over 3,000 different tests in one place, how to track and manage all your results, how to have your patient experience streamlined. Again, the idea here is to build a product that allows you to work more efficiently and effectively without having to worry about all the admin and support work that can oftentimes be associated with these tests. Beyond that, being the core product for Rupa, things such as these live classes. So you're all actually part of Rupa University right now. We host these classes on a weekly basis every Wednesday at 11 o'clock Pacific, where we'll have practitioners or our lab partners come in to give these amazing conversations and talks about topics that are important and impacting the functional medicine landscape. So feel free to join for next week and the weeks after that. We're booked out every single week up, really through basically August at this point. So keep an eye out for these. We'll update this and add what's coming up on the schedule. So if anything looks interesting to you, please join us here. So education being a really core component to Rupa Health as we continue to grow. So beyond just live classes that we offer, things such as a boot camp that we're having, a podcast, a magazine. So really Rupa being a functional medicine landscape and platform where you can come and continue to learn beyond just a place where you can come and place your orders for your lab work. So with that, y'all, my name is Adrian. I'm the head of practitioner partnerships here at Rupa Health. And if you do have any questions and are interested in setting up a meeting where we can talk a little bit more specifically about your clinic, feel free to reach out. My email is adrian@rupahealth.com. That's my phone number there. I really look forward to speaking with some of you in the near future here. And I appreciate you sticking around. I know we went a little bit over time today, but thank you so much. And I hope you enjoy the rest of your Wednesday afternoon.